Every morning, before you start your day, someone else has already started their day. The security guard at the gate, the cook in your kitchen, the driver downstairs, and the house help moving from one building to the other. Their work keeps the city running. Their health is rarely the part of the picture. Most people feel fine, capable, and functional. They finish their work, move on to the next, and continue their task. Yes, something is changing quietly inside their bodies. The idea was very simple. If people don't care about their health, what happens when healthcare comes to them? This is Shankar, a cook in Mumbai. On 23rd September 2025, he was working when he heard that the mobile clinic was in their building doing free health and eye checkup. He visited the mobile clinic, not worrying, not panicking. He didn't think this day would change anything.
क्योंकि लाइफ में तो सब अपना अब खुद सही रहेंगे तो सब कुछ सही है। अगर खुद ही नहीं सही रहेंगे तो फिर क्या होगा? जैसे मेरा नाम शंकर है। मुझे मुंबई में 17 साल लगभग हो गया है। मैं यहाँ पर ही एक जगह ही काम करता हूँ। मुझे यहाँ पर 17 साल से काम कर रहा हूँ। 6 बजे उठता हूँ, उसके बाद अपना फ्रेश-व्रेश होके फिर यहाँ काम पे आ जाता हूँ, 7 बजे लगभग आ जाता हूँ। फिर शाम को खाना-वाना होने के बाद मैं 9-10 बजे के अंदर चला जाता हूँ रूम पे। मैं वहाँ पर गए तो आँख का टेस्ट हुआ, उसके ब्लड का टेस्ट दिया। फिर उसके बाद 2 रोज़ के बाद रिपोर्ट आया। रिपोर्ट आने के बाद फिर मैंने डॉक्टर से पूछा, जो इसमें कुछ प्रॉब्लम है क्या? तो बोले आपका विटामिन डी का कमी है, थोड़ा बॉर्डर लाइन आ रहा है।
For most people, regardless of their work, health is not a priority. Not because it's not important, because everything else seems to be more important. On the other hand, health can wait. When we looked at the reports together, it wasn't how critical the results were, it was how often the same deficiencies appeared. Different people, different jobs, same patterns.
Screening that what we have done between the age approximately between 20 to 60, and out of this more than 70% of the people are having any form of hypertension problems.
We sat down with Dr. Arolkar to understand the health reports and the emerging patterns. So, what were the major health related findings on the ground?
So we observed that people came for the first time for actual health screening. People don't realize unless their day-to-day activities are getting compromised by any of the medical problems.
Can the health deficiencies go unnoticed in the day-to-day lives, especially in the communities where Project Dhanvantari was serving?
Definitely, the major concern is about awareness, acceptance. People really don't want to accept. Initial stages, maybe of hypertension, maybe of diabetes, maybe of cardiovascular diseases, always there are some kind of signs or symptoms that body is showing, but people take it as a normal.
Also, why do deficiencies take so long to be diagnosed?
When it comes to a deficiency, it do not come all of a sudden. So it slowly deteriorates to the level where patients or the people starts getting those kind of symptoms.
When the reports came together, it wasn't one condition we saw. It was often multiple, and that too in the same person. Almost all of them did not know about the deficiencies they had. What we saw on the ground didn't happen by chance. It happened because healthcare was made more accessible to people. Project Dhanvantri wasn't created to respond to medical emergencies or fix one illness. It had one objective in mind, which was to provide easy access to healthcare. No appointments, no travel, no waiting for the doctor. Healthcare just fitting into your everyday life. To understand what the Project Dhanvantari was meant to do and what it actually revealed, I sat down with the person who oversaw the entire campaign, Rajendra. So, how did this idea come into play, and what was the real problem that RBL and Zenzo were trying to solve with Project Dhanvantari?
So this discussion started exactly 3 years back. They wanted to do something in healthcare space for the community. So wherever RBL Bank branches are there across tier 1, tier 2, tier 3 cities, they wanted to do health and wellness activities in the nearby catchment area as a part of CSR initiatives. And that's how this concept started. So we decided to go into a residential areas where the targeted population is basically housemaids, security guards, drivers. So this category is completely neglected. If you look at these kind of people, they have never done a health checkup or eye checkup kind of activity in past.
So, from the implementation point of view, what were the major challenges you faced in implementing Project Dhanvantri across different states?
So the first challenge was these mobile camps are basically it's a great example of huge coordination. RBL branch team actually gets the building permissions and we do not get the building permission on consecutive days. So there are some gaps also. So keeping the manpower intact and available throughout the project duration, that was the one of the challenge, but we successfully managed. Initially we started with Mumbai, then gradually it increased to 4 cities. Now we are covering around 35 cities across 12 states in India. When we started this activity first year, so that was a pilot project for us. So first year we did around 6,000 registration and it was almost a nightmare for us to do paper registration and then manage the data, put that into Excel sheet. But as we gradually go on and the volume started increasing, we developed in-house web application which actually helped us to manage data in much better way.
Wow.
So technology has played a key role in terms of managing the overall project.
Can you also tell us what kind of tests were done at the mobile unit level?
So we are doing blood pressure, random blood sugar, total cholesterol, TSH, which is a part of thyroid test, vitamin D and vitamin B12. So these are the 7 tests what we are doing. Apart from that, we did the eye checkup also, routine eye checkup, where those people who are having problem with reading eyesight, we have given them the eyeglasses on the spot.
And how do you communicate to them the results?
So once the health checkup is done, we send the reports as a link through SMS or WhatsApp. Another way is that we send the reports to the nearest RBL Bank branch and then branch team goes to that society and hand deliver those reports to those beneficiaries. So this is the way we actually have delivered the reports. And once the reports are delivered, our central team of doctors, they outcall each and every beneficiary. The purpose of this doctor consultation is that if you give a stack of reports to driver or the housemaid, they will not understand the meaning of those reports. So it is extremely important that medical professional or physician calls those people and brief them about what those report means or what the readings of those report means and let them know how to read those reports basically.
Project Dhanvantri made healthcare more accessible to people, especially those who do not treat health as a priority. However, access to healthcare at this scale needed more than just good intent. It needed the right implementation partner. What began as a simple idea turned into a journey across the country. From Maharashtra to Punjab, 14 states, 35 cities, more than 1 lakh beneficiaries, most of them tested for the first time. This was not easy at all to execute. It was super complex, logistical, relentless. But in the end, it all worked. It is partnerships like this between Zenzo and RBL Bank that go a long way in serving the society at large. To understand why this mattered and what it takes to support a project at this scale, our team spoke to Rekha, Deputy Manager CSR, RBL Bank.
ये हम लोगों ने 2023 में प्रोजेक्ट स्टार्ट किया था. हमारा प्रोजेक्ट का नाम भी वो टाइम पे हम लोगों ने दिया था धन्वंतरी मोबाइल हेल्थ केयर इनिशिएटिव. हम लोगों ने ये स्टार्ट किया कि क्यों ना हम लोग उनके लोकेशन पे जाए तो उनका टाइम भी बचेगा, उनको ट्रैवलिंग करने के लिए नहीं मिलेगा, उनका कॉस्टिंग सेव होगा. एंड वर्क प्लेस से कैसे है ना, हम लोगों को ज़्यादा वर्कर्स मिलेंगे. अगर कोई भी सोसाइटी ले लो, अगर सोसाइटी में एक अच्छी रहता है, वहाँ पे ऑलमोस्ट मोर देन 100+ हाउस स्टाफ रहते हैं जो काम करने के लिए आते हैं. सिक्योरिटी गार्ड्स होता है, गार्डनर्स होते हैं. तो ये सारे लोग अगर हम लोगों को एक सेम टाइम पे मिलेंगे तो अवेयरनेस ज़्यादा होगा, बेनिफिशरीज ज़्यादा मिलेंगे हम लोगों को. तो वो प्रोजेक्ट इम्प्लीमेंट करने के लिए हम लोगों को पार्टनर्स रिक्वायर्ड थे. तो हम लोगों को मल्टीपल प्रपोजल आए मल्टीपल पार्टनर्स के एंड से. एंड हमारे बोर्ड ने फाइनलाइज किया जेंजो. एंड जब हम लोगों ने एक्टिविटी स्टार्ट किया था दैट टाइम पूरा जो प्रोजेक्ट था वो हम लोगों ने प्लान किया था मैन्युअली। लाइक हम लोग 4 सिटीज़ में ये प्रोजेक्ट हम लोगों ने कवर किया था, जिसमें से ऑलमोस्ट 6400 प्लस बेनिफिशियरी हम लोगों ने कवर किए थे। एंड जब ये इतना अच्छा रिस्पॉन्स हम लोगों को ये एक्टिविटी से आने लगा तो हमारी ब्रांचेस से वो हम लोगों को इंसिस्ट करने लगे कि आप एक्टिविटी कंटिन्यू क्यों नहीं कर रहे हो, आप एक स्पेसिफिक पीरियड के लिए ही क्यों इसको लिमिटेड कर रहे हो। तो हम लोगों ने बोला नेक्स्ट ईयर के लिए फिर हम लोगों ने सेम एक्टिविटी को कंटिन्यू किया। एंड दैट टाइम हम लोगों ने उनको सजेशन दिया कि अभी जो मैनुअल करे कि व्हाई नॉट हम लोग डिजिटली उसको करें। तो हम लोगों ने उनको प्रपोजल रखा एंड दे क्रिएट वन पोर्टल जिसमें हम अभी पूरा बेनिफिशियरीज का डेटा मिलता है, इंक्लूडिंग देयर मोबाइल नंबर, देयर एड्रेस, इवन देयर हेल्थ चेकअप्स डिटेल्स। तो ये पूरा पोर्टल उन्होंने क्रिएट किया एंड विद दैट पोर्टल अभी जो हमारा टास्क है लाइक डॉक्यूमेंट सेव करना, बेनिफिशियरी काउंट ट्रैक करना, लोकेशन ट्रैक करना, वो इतना भी इजी हो गया। ऑलमोस्ट हमारा सेकेंड ईयर का काउंट इज 26,000। सो 6,000 से 26,000 इज ऑलमोस्ट 4x काउंट हमारा इंक्रीज हुआ है। ये करंट ईयर के लिए हम लोगों को 60,000 का टारगेट मिला था एंड ऑलमोस्ट 24 सिटीज हम लोगों ने ये साल कवर किए हैं एंड अभी तक हमारा 58 प्लस काउंट हो चुका है। सो वी आर ट्राइंग कि फेब एंड तक हमारा वो प्रोजेक्ट पूरा कंप्लीट करें 63,000।
India's healthcare system continues to have critical gaps, with 70% of the population not having access to quality care. At Zenzo, we believe that along with corporates, institutions, NGOs, we can help bridge this gap in a small way. Initiatives like Project Dhanvantari have benefited more than 1 lakh people across 14 states and has created an example on how the private sector can bring about a meaningful difference in India. And this is just the start.